all to today's session. Myself Rajita, and in this session we are going to discuss very common symptoms which will be often present among the client who are seeking medical care into your clinical setup. Now this common symptoms is named as edema. So I hope you are very well versed about this particular term of edema. It basically means that nothing but an abnormal accumulation of extracellular fluid within individual's body. So which basically will be causing certain inflammation or inflamed area of the body, and we are going to term this type of accumulation of abnormal fluid into the extracellular space as edema. So here in today's session, we are going to learn regarding edema, what are the basic types of it, what are the main causes, and what are the basic concept of the management of these symptoms of edema. So let's get started with the topic of edema. So before going to discuss regarding the details how the edema is formed, what are the causes, and what will be the clinical manifestations as those are, we should first learn that basic concept of fluid balance in the body. So I hope in the previous session where I have discussed regarding the fluid and electrolyte balance in the body, we have discussed in detail that how the fluids are being placed inside an individual human being, how it is going to be regulated over the body. Now here, first, we will be just revising about the fluid balance in individual's body in detail. So you need to remember, it is a very important point that our body weight, 60% of the body weight will be composed of water. Now this water or fluid will be divided into two basic compartments that includes the intracellular and extracellular compartment. So intracellular compartment is basically the fluids that are present within the cells. Extracellular suggests the fluids that are present outside the cells. So extracellular fluids will be further divided into intravascular fluid and interstitial fluid. So that's how the fluids is going to be present in every individual's body at a physiological state. When this particular extracellular fluid is going to increase maximum, and if it is increasing in excessive level, we are going to see a person will be present with the symptoms of edema. So now we are going to read about the normal fluid circulation. We have already learned it in fluid electrolyte balance discussion. We will be just revising how the fluid is getting regulated within our individual's body at a physiological state. So the movement of the fluid within and outside of the vasculature will be regulated basically by two opposing pressure that includes a vascular hydrostatic pressure, and the second one is the plasma colloid pressure. So I hope we have already learned regarding the vascular hydrostatic pressure and plasma colloid osmotic pressure in details. So you need to remember this hydrostatic pressure often will be causing the fluid to escape from the intravascular space to the extravascular space. That is how we are going to see hydrostatic pressure will be almost always high into the arteriolar end. That is the reason here from the arterioles, the fluids will be getting escaped from the intravascular space to the extravascular space. Whereas we are going to see in the venules end, the oncotic pressure will be more. As here the oncotic pressure is more, it is basically helping the venules to withdraw all the fluids from the extravascular spaces which has been escaped out from the arterioles. That is how the fluids is going to be traveling through the arterial as well as to the veins, and it will be circulated and regulated all over the body. Now, exit of the fluid from the arteriolar ends and entrance of the fluids into the venular ends will be balanced at the microcirculation. That is how our extravascular and intravascular, intracellular and extracellular fluid will be completely having a balance. Now, small residual amount of extravascular fluid will be almost always found. Now, excess interstitial fluid will be definitely drained through the lymphatics channel. That is how a whole normal balance will be maintained. Now, any disease process or any etiological factor or any pathophysiological changes, if it is affecting the hydrostatic pressure, oncotic pressure, or the activities of the arterioles or venules, even if it is affecting the lymphatic system of the body, we are going to see then a person would develop with the symptoms of edema. So now we are going to discuss regarding the exact causes which will be almost always associated with the development of the symptoms of edema. So already we have learned that edema is an abnormal accumulation of fluid into the interstitial spaces located beneath the skin and between the body cavities. Now, edema is a normal response of the body towards inflammation as well as any injury. Even with infectious process also, edema is very commonly seen among the client. So in some cases where the person is suffering from an infectious process, edema is basically have a beneficial role. It improves the white blood cell circulation to the localized area where the infection is present. That's how basically edema formation will be helping to control the growth of the bacteria, viruses, or the infectious organisms to the localized area where there will be accumulation of WBC, basically the white blood cells in that particular region. So I hope you got the concept that as there is increased amount of fluid accumulation, that ultimately will be increasing the presence of increased amount of white blood cells. Ultimately, it will be having a very effective fighting towards the infectious organisms that are present in the localized area. Now, we're going to discuss what can be the basic causes to develop this particular symptoms of edema. So the first one is increased hydrostatic pressure. So raised hydrostatic pressure often will be found in case of kidney and heart associated diseases. Now this will be causing retention of the water in the interstitial way or interstitial spaces that ultimately will be developing the condition of edema. Reduced plasma oncotic pressure is considered the second major cause of the development of the symptoms of edema. Increased blood vessel wall permeability, which will definitely will be increasing the escape of the fluid from the intravascular spaces to the extravascular space. Example of the condition which increase the capillary permeability includes inflammation, which can be acute or chronic. That is the reason almost always associated with the inflammatory changes, we are going to see our client will be developed with edema or excess accumulation of interstitial fluid due to increase in the capillary permeability. The fourth factor, which often will be inducing the development of edema, is obstruction of fluid clearance via the lymphatic system. So, any disease condition or any obstruction into the lymphatic channel almost always will be causing the development of edema. Now, the fifth factor here, which will be often associated with the edema formation, is definitely changes in the water retaining capacity of the tissues. This all five factors are considered to be the major factors which will be often often related with the development of edema in an individual's body. Now, first, here we are going to discuss regarding the increased capillary hydrostatic pressure, how it is causing the development of edema. Here, basically, the hydrostatic pressure at the venular end will be increased more than the oncotic pressure. That is the reason we are going to see there will be minimal or no absorption of the fluid at the venular end. That is the reason in the interstitial spaces there will be excess accumulation of fluid, which ultimately will be causing the development of edema in an individual. Next, we are going to see how the reduced plasma oncotic pressure is going to develop the cases of edema. Here, we are going to see there will be reduction in the albumin synthesis by the liver, or maybe due to protein malnutrition, there will be less amount of albumin or other proteins will be present. Now, these proteins will be basically regulating the oncotic pressure into the venous system as well as to the arterial system in the body. Now, as there is fall in the albumin, basically we are going to see this decreased protein level ultimately will be reducing the oncotic pressure within the arteries. That is the reason there will no fluid movement will occur from the interstitial place towards the venules, and that is the reason we are going to see that there will be accumulation of interstitial fluid that will be ultimately leads to the development of edema. Even these conditions of in decreased oncotic pressure will be definitely letting the fluid escape from the cells into the interstitial spaces. That is how an individual will be slowly developed with the symptoms of edema. Next, we are going to see how the inflammation is causing the development of edema in an individual. So as we have learned here, the capillary endothelial injury will be present due to the inflammation process. Now, inflammation can basically will be occurring because of the presence of toxin, and it will be also regulated by the histamine. Also, there will be presence of anorexia or drugs. Now, this will be ultimately causing an endothelial cell injury. That is the reason here the endothelial gaps are getting increased. So it is ultimately leading to increased capillary permeability or to the plasma membrane. Ultimately, it is basically reducing the plasma oncotic pressure. That is the reason we are going to see soon after the development or the reduction of the plasma oncotic pressure and increased capillary permeability, the fluid will be escaping from the cells to the interstitial space. Due to the excess accumulation of the fluid into the interstitial space, definitely our client will be developed with edema. So that is how inflammation is going to increase the capillary permeability and will be increasing the chances to develop of edema for our individual. Now the next factor is lymphatic obstruction. Any disease which is impairing the lymphatic drainage system, we are going to see those will be ultimately leading to the development of edema in our individual. So localized lymphedema is very common among those patients who are going for radical mastectomy surgery associated with carcinoma of breast. Even if it is increasing the pressure on the main lymphatic ducts, then also we are going to see the person is more likely to develop with edema. Inflammation of the lymphatics, even occlusion of the lymphatics by the presence of malignant cells, filariasis disease condition also will be blocking the lymphatic channels, which will be ultimately will be developing the condition of edema. The fifth condition is sodium and water retention. Here what happens basically, once a person is in a hypovolemic state, we're going to see there will be three reactions. First, there will be presence of renal vasoconstriction. The second one, there will be increased secretion or production of renin and aldosterone hormone. The next we are going to see there will be increased antidiuretic hormone. So as there is renal vasoconstriction, we are going to see definitely the glomerular filtration rate will be decreased. In the second, where there is excessive production of renin and aldosterone secretion, definitely it will be conserving more amount of water in the body. The third is increase in the antidiuretic hormone. Definitely, this increase in the antidiuretic hormone will be causing excessive reabsorption of the water into the body. So all these three factors ultimately is leading to the retention of the sodium and water in the body, and ultimately it will be leading to the development of edema. So often we are going to see a person with kidney disease or acute kidney failure will be showing the edema, which will be following the same pathophysiological process or pathway to develop. Next, we are going to learn here about the classification of edema. So as we have learned the five major causes, we have also seen the pathophysiological way how the edema is developed because of these five main factors. Now we are going to learn there are two basic classification of edema, which is classified under localized edema and a generalized edema. So first here we're going to learn regarding the generalized edema in individual. Now generalized edema is basically a condition where we are going to notice the swelling, puffiness, basically the water retention in various parts of the body. Now the parts can include the area of abdomen, arms or upper extremities, legs or lower extremities, even the feet. Symptoms associated with generalized edema often includes the bloating, tingling sensation over the skin. Even we are going to see the skin will be looking very pale, thin and shiny. Now as we have learned regarding the generalized edema, now definitely we are going to learn now what are the basic disease condition will be often associated with the development of generalized edema in individual. Now the disease condition includes congestive heart failure, nephrotic syndrome, cirrhosis of liver or systemic infection. Now these all factors are some or the other way causing the five main etiological factor related alteration. In congestive heart failure, we are often going to see due to the poor perfusion of the kidney, there will be excess production of renin and aldosterone and antidiuretic hormone. Ultimately, it is causing excess amount of reabsorption of the fluid. That is how the fluid volume of the body will be increased. Basically, the interstitial fluid here will be increased. In the second case, where we are going to see the nephrotic syndrome. So next we are going to see the second disease condition is nephrotic syndrome, which often will be alternating the function of the kidney. That is how we are going to see the water retention here will be taking place. In case of next disease, that is the chronic or cirrhosis of liver, we're going to see the albumin level here will be decreased. That is the reason why the oncotic pressure will be decreased, and ultimately it will be causing escapism of the fluid from the intravascular and intracellular space into the interstitial space. Systemic infection similarly will also cause inflammation, and ultimately the inflammation itself will be causing increased capillary permeability and ultimately will be leading to the development of edema for our individual. So as we have learned now regarding the generalized edema, here we're going to learn about the localized edema now. Localized edema can be defined as the type of edema which is confined on a particular body part or organ. The various disease conditions or causes can lead to the development of localized edema. It can include a traumatic injury that can be a smaller or a huge traumatic injury. The next condition include infection. Now, infection can be a localized or a systemic infection which will be ultimately cause the development of inflammation and ultimately will be leading to the development of edema. The third condition is the lymphatic obstruction by the filariasis. So, this particular disease condition will be directly affecting a localized area and associated lymphatic system and drainage. That is how, there in that particular localized area, we're going to see as the lymphatic drainage is not effective enough, a person will be developing the presence of edema. Now, generally, we are going to see in case of filariasis, often the lower extremity will be affected due to the obstruction of the lymphatic system. The next we are going to see the venous obstruction. So basically in venous obstruction we are often going to see the development of thrombosis. Ultimately this thrombosis development will be leading to the development of localized edema. So I hope you are clear about the two basic classification that includes the condition of a generalized edema and a localized edema. Now we are going to learn about the edema which will be classified based on their peating ability. So it's classified as peating edema and non-peating edema. So now we are going to read about the peating and the non-peating edema in details. Now, cutaneous edema is generally termed as peating edema when after the pressure is applied to the small area where the edema is present, we're going to see there will be formation of an indentation which will be persist for a bit duration even after the release of the pressure from that particular area. That is what we are going to call as the peating edema. Peripheral peating edema is the more common type which will be often resulting from the water retention. It is basically seen among the or in the extremities. It can be caused because of certain systemic disease. Even pregnancy sometimes will be developing the condition of edema or peating edema development. Heart failure as a direct or as an indirect way also will be developing the condition of edema. Local conditions such as varicose vein, thrombophlebitis, infects, bites also will be leading to the development of localized peating edema. Dermatitis is also considered to be a very common factor or disease condition which will be often causing the peating edema. Now, non-peating edema will be mentioned when there is no presence of indentation after releasing the pressure that has been applied to the edematous area. So basically the conditions which will be often causing non-peating edema includes lymphedema as well as the edema which is associated with mixed edema. Next we are going to see the major three different types of edema based on their location or body part involved. Now, depending on this classification, edema can be classified under three major categories. The first one is peripheral edema, the second one is pulmonary edema, and the third one is cerebral edema. So this tree classification is done based on the presence or the location that is involved in the process of edema. And this tree, that is peripheral, pulmonary and cerebral edema, are the most common types of edema that are being found among the clients seeking medical care within a clinical setup. So now let us study regarding the peripheral edema. Now, peripheral edema often includes the parts of lower extremities, feet and upper extremities. Even the ankles also will be involved. This is the most common types of edema which will be often present among the patient, and often we are going to see this peripheral edema will be majority of the cases will be present into the lower extremity. This type of edema can be developed with an increased age, Pregnancy also considered to be one of the major risk factor to develop the peripheral edema. Hypertension, congestive heart failure, kidney associated disorders and other health condition which is affecting the oncotic pressure and hydrostatic pressure often will be helping to develop the condition of peripheral edema. Now certain factors like the usage of non-steroidal anti-inflammatory drugs, corticosteroid drugs for a prolonged time also can increase the development of peripheral edema. Now if a person is on a prolonged time sitting and standing position, then also sometimes we are going to see a person may likely to develop with peripheral edema to their lower extremities. Next, we are going to learn about the second type of common edema, that is the pulmonary edema. So as the term itself is suggesting, this particular edema will be affecting the pulmonary vasculature. So basically the pulmonary edema nothing but the accumulation of the fluid inside the lungs. Now this occurs due to the blockage into the pulmonary veins. So our blood pressure when it is rises to the pulmonary vasculature, we're going to see this actually can increase the fluid leakage to the pulmonary area, and we're going to see there will be excess accumulation of interstitial fluid which will be ultimately causing the development of pulmonary edema. Now, the pleural cavity also sometimes can be present with excessive accumulation of fluid. Now, in this case, where the pleural cavity is present with excessive fluid in it, we are going to term that particular condition as pleural effusion. Now, pulmonary edema will be often caused by the malfunctioning of the left ventricle of the heart. We're often going to see if the left ventricle is not working properly, there will be backing up of the blood into the left atrium as well as to the pulmonary vein. And that is when we're going to see there will be presence of increased pressure into the pulmonary vein. That is the reason why in the pulmonary vasculature, there will be increased hydrostatic pressure, decreased oncotic pressure as well as increased capillary permeability, which ultimately will be helping the fluid to escape the pulmonary vasculature and to get build up into the interstitial spaces that are present within the pulmonary area. That is when the pulmonary edema will be developed. The other causes often includes the acute respiratory distress syndrome. This often will be affecting the pulmonary vasculature and there will be presence of inflammation and increased capillary permeability. And the second cause is the hypersensitivity reaction. So associated with the hypersensitivity reaction, we are going to see often the pink frothy sputum will be produced from the client, and that is a significant classic symptom of the presence of edema within the pulmonary area. Next, we are going to learn about the cerebral edema. So as the term itself is suggesting, we are going to see this particular edema will be present or will be happening into the cerebrovascular area. Here, the fluid will be getting accumulated into the intracellular or extracellular spaces within the brain. It can be caused by some metabolic disease, some systemic disease, or decreased oxygen supply or oxygen deprivation in the high altitudes. So these three major causes will be almost always develop the condition of cerebral edema. Now cerebral edema is a very serious form of edema. It can lead to the loss of consciousness, even brain damage. Cerebral edema can be further divided into three subtypes. It includes vasogenic cerebral edema, cytotoxic cerebral edema, and interstitial cerebral edema. So vasogenic cerebral edema occurs when the blood-brain barrier will break down. Now this allows plasma to leak inside the brain, and first it will be reaching to the white matter before getting into the gray matter. So basically the vasogenic cerebral edema often will be starting with the white matter of the brain. This type of cerebral edema will be caused because of the brain tumor, a direct traumatic injury, or cardiovascular event. Next, we are going to learn about the cytotoxic cerebral edema. So, it is caused because of the malfunctioning of the sodium and potassium pump within the glial cells of the brain. So, this ultimately will be causing retention of the sodium and water intracellularly. We're going to see the swelling primarily will be present in both the gray matter and white matter of the brain. In case of cytotoxic edema, it is a very important point to note down that the blood-brain barrier will be unaffected. Now, in interstitial edema of the cerebrum, we're going to see it will be occurring when the barrier between the brain and the cerebrospinal fluid will be ruptured. This cases will increase the inflow of the cerebrospinal fluid into the brain, and it will be causing the accumulation of the cerebrospinal fluid into the white matter and to the extracellular spaces. So I hope till here you are completely clear about the types of edema that can be present among the client. Now we should definitely see about the clinical manifestation. So as you know, the edema will be often causing a swelling. There will be presence of very thin and shiny skin, and the edema can show up pitting in nature, and definitely the client will be complaining about the discomfort. Now you need to understand the all the other symptoms which will be present associated with the edema often will be related with the underlying disease condition and the type of edema what are present for the client. So as we have learned regarding the presence of edema, the process or the pathophysiological process, how it is occurring, as well as the basic clinical manifestations which will be often associatively present in a patient. Now we should learn about the management of edema in details. So here we are going to give a basic concept of the management of edema. So first and foremost, definitely as a medical professional, we need to ensure a full medical history taking from the client. It includes the pre-existing conditions, prior surgery, medication usage. That includes even the contraception, hormonal therapies, over-the-counter medications as well. Basically, we need to focus whether the person have a history of the usage of non-steroidal anti-inflammatory medication use or corticosteroid use or not. Consent should be include the full explanation on the risk of effects and complication, whatever the treatment plan will be suggested for the client. Now, often associated with infection or injection site, we're going to see the presence of edema. That is the reason here the client will be priorly explained about the risk, as well as we sometimes will be preferably ask the client to use some medications like mannitol, which will be ultimately helping to reduce the risk of developing edema associated with some therapeutic dosage or therapeutic procedures. So often we're going to see that the client will be asked regarding all the medical histories and the probable disease factors, and through the history collection, a medical professional would be definitely able to conclude whether the person is having an increased risk of the development edema, or whether which are the probable disease condition can be related with the development of edema. Now, if the edema has been associatedly formed with a therapeutic treatment procedure like administration of injection, definitely applying gentle massage to the localized area will be often curing the condition. But if this condition is related to some inflammation, infection, or other cardiovascular disease or any kidney disease, definitive management of the underlying causes will be definitely helping to manage the condition of the development of edema. Now here, the edemas, if it is present less than 2 weeks of duration, we are going to see majority of the cases, we are going to ask the client to maintain the appropriate positioning, where majority of the cases, the client would be asked to raise the particular body area which has been present with the edema with the level or compared to the level of the cardiovascular system. So we are going to see the client will be having an elevation of the particular body part which has been affected with the edema. The next condition definitely implies the application or the administration of ice or cold packs as well as the warm compressions. Now, depending on the client's condition, medical professionals or basically a physician would be suggested to go for administration or application of cold or warm compression. Sometimes the gentle massage will be provided to the localized area in order to improve the lymphatic drainage if the edema is present less than 2 weeks of duration for a client. Unless and until edema is so severe, generally medications regimen would not be prescribed to the patient. So here basically if the person is having a severe edema, a steroidal oral supplementation can be prescribed to manage the condition. Now, depending on the disease process which is present underlying, depending on that, medical professionals or a physician would be suggested to go for certain therapeutic procedure. So a person who is present with acute renal failure often would be suggested to go for a hemodialysis method. Even medications like antidiuretic hormone often would be supplemented to the patient in order to promote the diuresis. Often a client would be asked to usage about the medication. So if there is presence of any medications regimen which is more likely to have an association with the development of edema, they would be suggested to stop the medications regimen. Here, often the client would be suggested or prescribed with the diuretics, which will be often used to treat or promote the uresis or diuresis process, which will be ultimately decreasing the chances of the edema development. That is how, in a patient, depending on the underlying conditions, different medical regimens and surgical or certain techniques like hemodialysis would be prescribed to the client. Now remember, here a proper dietary intake, fluid volume balance maintenance, as well as a proper rest and sleep and activity, maintenance of a proper positioning and maintaining of hygiene, and reduction of the development of infection or any injury plays a very important role to manage the client effectively with edema. Nurses here plays a very important role to teach the client regarding the development of the symptoms, what are the causes associated with the development of these symptoms would be definitely described. Often, a nurse here plays a very important role to discuss the necessary lifestyle modification which will be definitely helps to prevent the development of edema and also which will be prevent the progression of this particular symptoms of edema further with the client and caregiver. That is how we are going to manage the client with edema. Majority of the cases we will be focusing on the treatment based on the underlying pathophysiological disorder. So I hope here in this session you understood the concept of edema, the types of edema, the probable causes, the clinical manifestations, as well as the basic concept of edema. So thank you so much for attending the session. I hope you have enjoyed this one. We will meet you guys in the next session.